Good afternoon, Dr. Lakhani. Very firm welcome to this afternoon, where you've very kindly given up your time to talk about practice level support.
Hello, everyone. My name is Dr. Lakhani. I'm a GP principal in Leicestershire, and I work at Highgate Medical Centre.
Maya, thank you. And to start the conversation, if I could pose the first question, which would be, what has been the best part of taking part in practice level support?
So I'd say two things to that. Firstly, just that opportunity to think about things. We found that we were so busy with managing day-to-day workload and seeing patients all the time and coping with the huge rise in workload that actually we hadn't devoted enough time to practice development, thinking about the future, about where we're going. And to have a chance to take part in the practice level support program was very good for us. The second thing I would say is being able to look at different parts of a practice every week. I liked that structure because it was driven by data. So we were quite keen to take part in a clever program.
Dr. Lakhani, thank you. And could I ask you next, what difference you think taking part has made to you as a practicing GP, your patients, of course, and your team at Highgate?
So through the work of the facilitator, who we really appreciated coming to the practice, and they looked at all aspects of a practice's functioning and working, we came across several areas that we needed to do more work on. Some of these were obvious to us, like GP access and managing phone calls. Others were surprising revelations, actually, which is one of the good things about the practice support framework, that actually this tells you things that you may have a blind spot for. So the difference is made is practically, firstly, answering phones and having a system for dealing with when is it the busiest, and that was provided by the call data. We made numerous other changes, for example, how we handle results within the practice, and that led to an innovation of a practice results clinic, and we've done questionnaires on this, which patients have enthusiastically welcomed, as have the other doctors and nurses. So this has led to practical change, but we also improved in a lot of other areas that came up, for example, redesigning our website. Simple things like changing the practice telephone messages. And that gave us something to unite around and to work on.
In terms of the problems that it's helped you to solve, or at least understand and manage better, are there perhaps one or two of those that stand out?
So we felt we needed to improve the way we manage the laboratory results that come in through a system called PathLinks. And we found that patients were phoning in for results, sometimes at the busiest time for the practice, which wasn't conducive. Quite often it wasn't clear what was meant to be said to the patient. And now, of course, with access to the NHS app, we were finding patients were concerned about results, and it often wasn't clear what the clinician had written. So we rationalized that and developed common scripts about what we write about messages. The idea was that we would enable patients to look at their results as far as possible within the NHS app. We also created a special protected space, a clinic space, where results that need actioning, for example, somebody who may have cancer or who may have had a particular request from a hospital for us to follow up, which is where the continuity of care is really important. We created a system where patients could book in and talk to somebody about their results if it was concerning. Generally would encourage them to see the doctor or nurse that initiated the test, but we also had a general results clinic slots where people could ring in, for example, to discuss if they wanted to go on statins. And we created this self-bookable booking links through AccuRx system. So that's made a big difference. And the difference it's made is that patients know that there'll be a proactive approach to results management. And secondly, it's taken the impact and demand on other aspects of the practice who are dealing with results that haven't perhaps been managed fully or cause worry to patients. So I would say that's one example of results management. Now that works for us. Every practice will have a different approach. Now, as part of this, and I'd really like to emphasize this, we embrace artificial intelligence to help us manage our results. So it wasn't just the previous system, but organized in clinics, but we actually use artificial intelligence. And we've got a provider who helps us manage our results with automatic assessments and filing, flagging up abnormal results. And that saved us hours of a doctor's time and improved the assessment of trends, for example, in laboratory results. So we learned that there was a problem with the results and how they're handled. The practice team came across that. We put in a solution and we embrace artificial intelligence, which we're able to do through the practice level support program. And there are a number of providers who assist practices in doing that. So I would say strongly consider the offer of a support framework, even if you think your practice is working well, which we thought actually. We thought we had got most things quite well worked out. We think a lot in our practice. We spend time working on processes. But actually, this revealed to us several areas where we needed to improve. And the coming together of the team was, I think, very important. So I would say, first of all, this is a sophisticated program. I know by nature practices tend to be skeptical of things, and they should be. We are skeptical of people coming in and saying, we've got the answer for you, because actually, to be realistic, if it was straightforward, practice would have done it straight away. But we kept an open mind. So keep an open mind. It is a high-level, sophisticated program. It's based on data and science. This is for us. It's for our practice. People, the facilitators who are very skilled, and they worked with other practices. And they will give you tips and suggestions. But as a practice, we worked out and prioritized what to do. The other benefits of it was I found that we found other practices were doing things, who were doing this program, and we visited them. So we learned about how they're, for example, doing total triage or using artificial intelligence to manage demand. So it brings you closer to your other practices in your PCN or neighboring areas. And I'm very glad we did it. I think it's not easy. I think I'll be realistic. You have to devote protected time to it, but actually it was manageable. It was manageable, and within the how we designed the program, it's very flexible. The facilitator works with you. So although it has an impact naturally because time has to be devoted, if there's not enough engagement, this may not work as well. So you have to commit to it, have to be engaged, have to think about the issues, and trust the program to give the key lines where you need to work, which may not be what you think, which is what we found, but we've improved our processes for high risk drug monitoring, which I know CQC are very interested in. We worked our clinical pharmacists to improve the monitoring of anticoagulation. Repeat prescribing is another key risk area for general practice, and we were able to implement the key areas of good practice, which I think has helped a great deal. So everybody's noticed the practice is working better and is much more efficient.
Dr. Lakhani, thank you so much for your time today. Huge amount there for practices to learn from and for your colleagues across general practice to understand the benefits of practice level support PLS and what it can do for them. As we close the interview, could you give some words to your colleagues and the team in general practice so that they can take away the benefits that you've experienced yourself?
Well, I'd say it's a great opportunity. We regard ourselves as being very fortunate to have been in the first wave of the practices to trial this. I feel practices have to devote some time and energy to their own development. You know, how are things working? What's working well? What's working less well? And to have a free support, high level of support for practice development using data that generates actionable insights, brings practice team members together, allows you to learn from other practices, I think is absolutely fantastic. Also, I would say we didn't find it overwhelming. We didn't want to take on something that's very onerous because, you know, we've got the day-to-day business of running the practice, you know, and this was just right. So I would highly recommend this program to you. And it is based on developmental principles, and you're in charge. Essentially, you then decide which areas you want to take forward. So I hope you'll consider it.
Dr. Lakhani, thank you again for your time today. Absolutely delighted that you could join us, and I know that your colleagues across general practice will be pleased to see you as well.